There are fresh concerns about the safety of hotel quarantine for returned travellers, with experts such as former Australian of the Year Patrick McGorry speaking out about the mental toll it's taking. There has been a suspected suicide at a Victorian quarantine hotel, while others have reported cases of depression and PTSD. Professor McGorry is amongst a group advising the Morrison government on this, and he joins me now. Thanks very much for your time. So, what is the advice? Because we spoke to someone today who just said it's a feeling of isolation, obviously, of a small room of no fresh air, but we know all the talk of the Victorian hotel quarantine system and the alternative if it's a bit lax. So what are you telling the government they should change at the moment?
Well, just to be clear, I'm not actually advising the government on this particular matter. Obviously, we have relationships with the federal government and the state government around broader mental health issues, but I have been asked my opinion about the predicament of people in quarantine, and obviously there's tremendous attention to their physical health during this quarantine period, and we've just been suggesting, which is pretty obvious actually, that there should be attention to people's mental health when they're in these under these conditions.
And so how much of that just comes from being in a very small room, no human contact? If that's the case, how do you counter that?
Yeah, I think every Victorian certainly, and probably most Australians can relate to the stressful nature of being confined to a small space and to have restrictions placed on movement and so on. That is stressful, and particularly when people are experiencing the stress of concern about whether they actually might be contracting COVID and so on. So it is a stressful situation. It's time limited, but as you pointed out in your introduction, it has claimed the life of at least one person so far, which is tragic. And so great care needs to be taken to support people when they're going through this transitional period.
What do we know about that case? And for example, how much support they were getting, whether they sought any, what the process was through that?
Yeah, I don't think we know that much about it. I think some details were released yesterday, so it's a bit hard to comment on that individual case, but clearly the outcome was pretty tragic. So, and it does highlight that this is a possible outcome of this sort of this policy. So risk management care needs to be taken, and it's not exactly difficult because people are being screened on a daily basis for their physical health. So why not build in mental health screening and just even the informal sort of types of support. We just had our Are You OK Day yesterday. It would be good to ask these people in quarantine if they are okay, and if they're not, help them reach out and get some professional help.
And how would that work in a practical sense? I mean, people obviously get screened for their health, as you say, physical health. You could have a couple of people in each hotel doing the rounds. You know, I suppose that the hotel doors open. They're on the other side, they have an element of protection with a mask and so on, and even from a few metres, it's just seeing someone from a few metres rather than just someone on a telephone where it might be easy to go, no, I'm fine, and hang it up. Is that an example? Are these practical measures possible?
Yeah, I guess there's two levels to it. One is prevention, basically trying to make sure they have as much connection to their family and friends and to supportive contacts as is possible under those conditions. That's the preventive approach, so that trying to make sure that people are their well-being is preserved, in fact. And then perhaps even screening at the entry into quarantine to see if people have a history of mental ill health in the past, which is going to probably place more demands on them under these conditions. So you might identify a high-risk group who are going to quarantine, and then probably just monitoring people, but not necessarily in an intrusive way, just in a more supportive way, just to check how they're actually going. And if they really are struggling, which probably many will, then providing the sort of stepwise support that might be needed. And you know, so it may not have been thought of prominently enough. That's the risk. I think when we're so preoccupied with the challenge and the crisis that's presented by this very contagious virus, it's important to remember that there are other health conditions that we need to be looking at as well. Patrick McGorry, appreciate your time today. Thank you. Many thanks. Thanks a lot.